Good morning, everyone. My name is Alex, and I'm a first year medical student. Today, I'll be talking about a topic which is DNR order, where death is a form of escape. So please do not misunderstand that DNR order is something like euthanasia or suicide, where people say that death is a form of escape. It is a bit different than that. It is the right to refuse medical treatment, so to say. So imagine this. You wake up in the morning, and the first thing you feel is not refreshed, but pain. Everything you do is painful. The bed you wake up from is actually a hospital bed. So you're actually been diagnosed with a terminal disease, and you have no hope of recovering. So in this case, it almost feels as if dying is the only means of escape. So would you choose it? But before that, let's think about this. What is actually DNR order? DNR is short for do not resuscitate. So do not resuscitate order means it is a medical order written by a doctor which instructs healthcare providers not to do any cardiopulmonary resuscitation on that patient. If that patient lost consciousness or does not have any heartbeat, nobody can do cardiopulmonary resuscitation on that patient. So that includes chest compressions, giving drugs that restart the heart, such as adrenaline, or intubation, where medical professionals they insert a tube straight directly into your lungs to help you breathe. No, so all these three, none of it will be given. So the next question would be, is DNR order legal in Malaysia? Because it essentially says that doctors will not help patients at all costs. So for Malaysia, it actually falls under a gray area where doctors and nurses in private hospitals will usually accept and follow a patient's DNR order. However, neither the Mental Health Act nor the Medical Act 1971 provide any legal framework regulating this advanced medical directive. So if as a doctor you follow the DNR order by your patient, nobody can sue you. But if you choose not to follow and you try and save the patient at all costs, it is not wrong as well. But if you choose to follow the DNR order in Malaysia, it may have some social implications where the doctors would feel as if you're not actually helping the patient anymore. Because we as doctors have four medical ethics that we have to follow, and one of it is to benefit the patient. So not helping the patient is as if you're letting them die. So now I'm going to be talking about the reasons DNR order is opted and signed by patient. So the first is if the patient feels that, or if the situation shows that effective CPR is unlikely to be successful. Secondly, successful CPR is likely to be followed by a low quality of life. And third, CPR is not in accord with the sustained wishes of the patient. So first, let's look at situations where effective CPR is unlikely to be successful. So what does it mean? It means that if the probability of saving that patient approaches zero, CPR is said to be futile and will be of no benefit to the patient. So the doctor will have no obligation to save that patient because the doctor knows that there is no way of saving that patient. Even if you are able to restart the heart will fail immediately. Next is if there is any underlying condition which may become life-threatening when CPR is administered. So I give an example of, say, a smoker which have underlying disease, maybe lung cancer or lung emphysema, which increases the probability of the lung puncturing. So if that patient, you can restart their heart, but At the same time, in the process of restarting their heart, you suddenly puncture their lungs. So you save the patient by restarting their heart, but the patient will die because he cannot breathe. So one disease will lead to another, and one condition will lead to another. So it is of no use, even if you try CPR to save the patient. So next, if any condition shows that successful CPR is likely to be followed by a low quality of life. So let's face reality, CPR is not perfect. CPR in movies, you can see that maybe after 10 to 20 chest compressions done to the patient wakes up and starts running or something like that. But in reality, it is very, very different. CPR may take as long as 5 minutes, 10 minutes, or maybe even until 20 minutes, where every passing minute means that your brain is deprived of oxygen, is deprived of blood supply. So for every passing minute, your brain suffers damage. For the first 5 minutes, it may seem as if it's normal, but until 20 minutes, even if you can bring that patient back to life, the patient may be comatose forever. So in this case, it's not like the doctor has saved that patient's life. It is that the doctor has only saved the patient's brainstem. So the heart continues beating, but the patient may never wake up again. And CPR also has secondary side effects. So CPR that is administered to a patient done by an untrained professional may cause rib fractures, damage to internal organs, rupture of trachea or esophagus. So it may be of no problem if that patient is still young and can recover from these injuries. But what about the elderly? What if they have to live with all these injuries in their body just because you saved their life? Is it a good thing? I don't think so. But there is a slight hope of them recovering. It's just that it's considered a suffering. It is very painful for them. So would they want it? It is up to their decision. So last one, CPR is not in accord with sustained wishes of the patient. So the patient choose not to resuscitate, and if their condition worsens and if their heart stops. So it may be due to personal reasons where the patient may be unsatisfied with the quality of life, or relational factors where the patient do not want to burden someone else with their suffering, or philosophical factors as if uh, the patient is realistic with the probability of living and may have just given up. So these are the thoughts of all the patients who have chosen DNR orders. It causes hardship for my family watching me suffer every day. If I'm going to live on a machine, somebody's going to take care of that machine, and I don't think that's fair. I don't want to be kept artificially alive when the body cannot sustain you, you're dead. Or as easy as, if I really have only 3 more months to live, I don't really want to have any more pain. So let's look back on the 3 reasons why people choose to sign the DNR order. So first is if the situation says that effective CPR is unlikely to be successful, where the probability of saving the patient approaches 0, or if successful CPR is likely followed to have a low quality of life, which may be caused by irreversible brain damage, or the patient may be comatose for life, or it is not in accord with sustained wishes of the patient. Now, this is all purely due to patient autonomy. The patient has all the right for him to choose what he wants to do with his life. So it is not up to the doctor's choice, but the doctor needs to explain to the patient what he's doing. So now the meaning of life is to be lived. But if you are suffering each and every day, you may choose to give up. And giving up sometimes is not the wrong choice. So thank you.